All right. Good morning, everyone. My name is Daniel. Today I will be walking you through CharmHealth's BillerPro product, which can be used to augment the insurance billing workflow for any Charm EHR customer. Can be used to manage billing for multiple Charm accounts, or it can be used as a standalone product with any practice using any EHR software. This will be a recorded webinar, so if you'd like a copy, you'll be able to request one at the end of the session. We will also have Q&A through the Q&A box. If you have any questions, please feel free to ask them in the box, and we will answer them at the end of the session. Um, with that, let's begin. So I'm just going to share my screen real quick. So the first place that we're going to go is rcm.charmtracker.com. This is the login for our Biller Pro product. And I'm just going to log into an account here. Okay. And you'll see that the first thing that we see when we log into an account is that we have multiple facilities to choose from. This account is set up and associated with multiple Charm facilities as well as a non-Charm facility. And account access can be configured by the BillerPro admin. So the admin for the BillerPro product. So that if you have multiple billers, coders, if you're running a company, you can assign account access to specific people so they would only be able to access the facilities that they work with. So I'm going to go to one of these facilities, and you'll see that the second thing that pops up is this RCM task notifications. This is just something that appears when a user signs in, and this is something that we'll cover later, but this is a way to essentially tell users that they have to open tasks that have been assigned to them. I'm just going to close this in the meantime. So the next thing that we see here is the billing dashboard. Now that I've gone into a facility, the dashboard gives you a brief overview of the practice. So the amount that's outstanding in total claim charges, amount that has come in collections for them, any assigned patient responsibility on those claims, contractual adjustments, any write-offs that have been performed, any denials that are outstanding, and the overall receivables on the account. And this also can be configured through date range. So you can see I selected this drop down at the top left here. You can select a certain time period to view this information for. Okay. So we'll begin with the core components of this software, how to use this product just for your day-to-day workflow, how to make sure you get your claims sent out. And the first place that we're going to go is under the left-hand side, under RCM Actions, we're going to go to Claim Submission. Now, this window should contain everything that you need to generate claims, but we're not going to start with claims just yet. The first place we're going to go is Demographics and Insurance Information. So on the top left here, you'll see that by default, the view is set to generated claims. And if you click on this drop down, you'll see that there are a whole host of options, not just related to claims. So if you want to adjust any provider information, you can do so here. Pay to address, patients, payers, procedure codes, everything that you need to set up your information so that you can start billing claims out and generating claims for these patients. So we're going to go to the patients first. And if the practice is using Charm EHR, this list will automatically be populated with all the patient information that is associated with the Charm account. Uh, for people who are billing for practices that are not associated with Charm, they can add in patients over here. So there's an option to add a new patient. This is more manual data entry, but you are able to put in their demographics, address, phone number, date of birth, all the necessary information that you need to get going on a claim. And then you're also able to add their insurance information here. Of And I'm going to go to a patient that's already put in, and we can also go to their insurance details. And we can see that this information was previously put in, but we can also add in a new insurance for a patient through here as well. And the insurance detail is where you can select the payer that this patient has and put in their policy details and their ID numbers as appropriate. If they have any prior authorizations, you can also put them in this section as well. You don't have to enter insurances over and over again. And you also don't have to add patients in directly through this link. So if the practice's EHR is not Charm, but they do allow exporting a list of patients and their demographics in a spreadsheet file, we have an option to import patients through a spreadsheet file, and you can import up to 500 of them at a time. So it is very possible to set this up so that you can just import, export patient demographics in a fairly quick manner. I would say most EHRs support some functionality for exporting this information. So you can import it into Charm, and this option also tells you how the columns need to be sorted. So similarly to the patient list, we also have a payers list. This is where you can set up your payers in advance, including their payer IDs, and you can also use this section to monitor which patients have which insurance. So if you click on one of these numbers under the number of patients using this payer, you can get a list of which patients have that. Okay. And I'm not going to go through all of these, but similarly, in terms of setting up procedure codes, providers, you are able to add all of them over here. So for providers, if you need to add any ID qualifier, such as taxonomy number, you can do so here. And this can also be a good place to store provider-specific information in case your billers or your AR team would need them to work denials. Okay. Um, so with that groundwork set up, we're going to go to uh, create a claim from scratch. And so I'm going to go to this encounters for claim generation. So again, if the practice is integrated with the EHR, there will be an option in there, and I'm going to show this later, where they can take an encounter that's signed by a provider and they can submit it to RCM, and it would become available in this list. And then the biller can generate a claim from here. But if you want to generate a claim manually, of I'm just going to go back. You'll see under the encounters for claim generation that there's an orange generate claim CMS 1500 form option. So if you click on this, then you will see a blank CMS 1500 form. And this should be fairly familiar for any biller. It's a standardized form. If you're just trying this software out for the first time and you've generated claims in another software, you could genuinely just print it out and just copy all of the information on here, and you can be assured that it will transmit exactly the same. But also, while this seems daunting to have to enter everything, most of the time you're just going to be able to put in a patient's information, and then their demographics will populate, their insurance information will populate. And from here, you can just put in the rendering provider information and then put in your CPTs, modifiers, which can also be automated, diagnosis codes, any claim-specific information that you need on here. And then when you're done, you will be able to either save this as a draft. This would be if you want to generate a claim, but it's incomplete, it's missing information, it's not ready to send out to insurance yet. Then you can just save it as a draft and it won't appear in your claim submission settings. or you can save as verified, which means that this claim is good to go and you want to send it out to insurance. So I'm just going to cancel this. And once you've added a claim through this way, it's going to appear under generated claims. So we're going to go to the generated claims view. This shows you a list of all the claims that have been generated for this facility. And you'll see that over on the upper right hand of the list, there's an e-claim submission option. So let's go over here. And you will have a list of all claims whose status is either verified or ready for resubmission. This is in the case of corrected claims. I'll show this in a second, but you can edit a claim, make any changes that you need, put in a resubmission code if that's the way the insurance wants it, and then save it as this ready for resubmission status so that it appears on this list and you can send it to the clearinghouse. So over here, we have a list of all the claims that are ready to be sent out, and you'll see that there are several options here. One is submit for testing. This is an Optum specific option. So currently we are integrated with Optum Clearinghouse, and this e-claim submission and electronic submission directly to a clearinghouse currently goes through Optum. And so submit for testing will put all of these claims through a special scrub that Optum has. They call it ACE testing. And that just gives you further information on claims. Some of them may come back with errors if they are missing an electronic specific um, or if there's an issue that is electronic specific with those claims that Optum catches in advance. Sometimes they're warnings. So Optum does maintain a database, for example. So if you bill, let's take an example. If you bill an initial E&M visit 99205 or 99204, Optum can sometimes detect if the same initial E&M codes have been billed for the same patient under the same tax ID within the last 3 years. And it gives you a warning saying that, hey, the insurance may not be okay with this because this should be a follow-up E&M code instead. But that's an example where they are just warnings, and you can override them and just submit the claims anyway if you feel that everything is billed correctly. Um, ACE testing tends to be a bit overzealous rather than underzealous. So not everything needs to be acted upon. And once you've run your checks, or if you don't even have to do the submit for testing at all. If you're confident that the claims that you've generated are good to go, then you can just hit submit to payers, and this will send the claims to Optum Clearinghouse, who will then route it to the insurance and to update with any transaction status as it happens. So you can monitor. Let me just close this for a second. We have a transaction status column here. So if you send it to Optum, then this will update saying that the claim is accepted by payer or acknowledged by payer, or if it's at an earlier stage where it's acknowledged by clearinghouse or acknowledged by gateway. And any rejections that come in for your claims, they will also appear here. And if you do have a rejection, so this is one, for example, then you would be able to click on it and you'd be able to see why it was rejected. So this probably doesn't have any information. This is just because this is a test claim. Um, but you can see the same information that the clearinghouse will send you. But let's say that you don't want to use Optum to as your clearinghouse. Maybe you have an established relationship with another clearinghouse already, or your particular practices needs are such that you don't actually need a clearinghouse. So we have several alternative options. One is this batch claim PIF option. So if you're uploading claims through a payer portal that supports PIF, then this option is enabled for all accounts automatically. It doesn't require anything additional. You'll just be able to select your claims and then download a PIF file of those claims so you can upload them into the payer portal. And then another option that we have, I'm going back to eClaim submission, and you see that there's this download ANSI file 837p option. So this is for billers and practices that are set up with another clearinghouse, you can still generate your claims in BillerPro and in Charm just fine. We can configure it so that those claims will generate with the correct submitter information for your clearinghouse. So you'll be able to generate all of your claims in BillerPro and then download them, and then you can upload them through the clearinghouse that you end up using. One other point I want to mention is that going back to patients, if you are integrated with Optum Clearinghouse, you can run eligibility checks through here as well. So we do support real-time eligibility. So if you add a patient and you want to check their eligibility immediately, you can do so over here, since we're on the subject of clearinghouse features. Uh, since we are on the subject of clearinghouse features, the next thing I want to talk about is once you've sent out claims and they've gone to the insurance and the insurance has processed them and the insurance comes back to you with remittances, either electronic or paper, you're going to want to be able to post them. So we support ERAs for again for Optum Clearinghouse. You can set up ERAs to come into Optum and then we pull them automatically, and we can post payments automatically as well. So back in this dashboard, I just went down into this RCM actions. There's an ERA payments section. And over here, this gives you a list of all the ERAs that have come into the practice. You'll be able to take a look at them. You'll see how many claims are located within that ERA. If there are any mapping issues, you'll be able to identify them here as well and resolve them. So a mapping issue would be, let's say, uh, for whatever reason, you submitted a claim and then the EOB comes back and it uses a patient account number or reference number that doesn't line up with what's in the system. There may be a mapping issue. There are also cases where if you send a claim and then you immediately send a corrected claim with different procedure codes or charges or any information like that, then when an EOB comes back or an ERA comes back for the initial claim, then it may have difficulty finding it just because that information has now changed. You are able to go in here and map and essentially post these payments accordingly and then mark them as work so you don't have to deal with them. Uh, the other option is if you don't have Optum set up, we're going to go back into this dashboard into the EOB's manual section. So this section is where you would either post EOBs manually, uh, or you can upload well, no. So this section is where you would add EOBs manually. You can upload ERAs. I'll get to that in a second. Um, but you can see that over here is a list of EOBs that have been manually posted. So if you go to the top right to this add EOB details, then you'll be able to enter the amount of the payment method, which payer, the check number, all of that basic information. You can also attach PDF files to the EOB. So it's generally good practice when you're posting a paper EOB to upload a copy so that people can reference it in the future. So let me, so once you select a payer, you're able to see a list of all the outstanding claims that are associated with that payer. Uh, so once you selected, so let's say you know that this EOB is going to go towards this claim over here. You can select it. And then for a reference number, you can put in the ICN number on that claim. But generally speaking, you're just going to be posting the amounts that the insurance paid, their payment information, any adjustment that was put onto there, any patient responsibility that's still outstanding. If you want to make any write-off decisions, you can do so here as well. Any comments that you want to add, and if you want to mark it as a denied claim, that just puts it in a special category where you can monitor and work your denied claims automatically. or rather, you can filter them and then work them all at once. I'm not going to post this. But I am going to go back because I did miss with the ERAs that we also have this upload ERA option. So if you're able to acquire an E835 file, either from another clearinghouse or if the insurance actually assists you and they send you these files, you can upload them in here as well. And they will they will come into here. They will also post automatically. So that way, if you're integrated with another clearinghouse and you're receiving ERAs through that clearinghouse, but you want to post them in BillerPro to make sure that your claims are marked as paid, this is the option that you would want to use. Okay. So next, we're going to go over patient billing. So once you post payments, some of them will have patient responsibilities associated with them, just co-pays, co-insurance, deductible, the standard. Uh, so we're going to go into this practice invoices section. And I've generally been talking around this a little bit. There is a difference between a claim and an invoice in our system, but generally speaking, you're going to be dealing with claims, and the invoices portion is automated. Uh, this uh, it works a little bit differently if you're using the EHR side of things, but in Biller Pro, it's simplified so that invoices are generally only for patient billing. So every claim has its own invoice associated with it. And if an invoice has patient responsibility, so let's go to the invoices section here. You can see that some of these, you can see the amount due on all of these. You can see which ones are partially paid, which ones are not paid at all. Some of these have patient balances on them already. You can see that over here. And here's where you can send invoices to patients directly. So I'm going to check off one of these invoices. And you'll see that there are several options here at the top. There's a print option, there's a send invoice option. So the print option is if you just wanted to print this invoice um, or download it as a PDF, you can do so over here. You can tell this is what it would look like. Uh, you can create templates for invoices so that you can customize how this looks. And that's set up even if the client is not an EHR customer. We still set up a dummy account so that you can modify those invoices. We also have the option to send invoices electronically. So we have three options actually. There's only two listed here, but there is a third. Um, so EHR clients, patients have patient portals that they can set up, and if they have a patient portal set up, then you can send an invoice to their PHR account. You will also have the option to send an invoice to their email, and it's not here, but there's also an option to send invoices to patients through text. And that's if the practice has text enabled. And if you send an invoice to a patient's email or through text, then it will be password protected. It would be a secure communication. The patient would have to put in a password. If you send it to their PHR, then the PHR login functions as their password. That's to ensure that this invoice process is HIPAA compliant. But you can see when you send an invoice, uh, you can you can indicate which invoice template you want to have attached to it, and you can see that this sends them a message as well. So this invoicing is generally if you want to send a patient just a one or two outstanding bills for specific claims. But what's also a very common scenario is that you want to send a patient a statement for their entire outstanding balance. And for that, we have a patient statement section where this is sorted by patients. And you can see how much is considered patient due for each patient. You can see the number of invoices that are associated with them. You can see if there's any major insurance that's still outstanding. And if you have sent statements to patients before, it will tell you when was the last time you sent it, how was it sent, and how many statements that you've sent to them. So if you have policies where You send patients to collections after you send a certain number of statements to them, and they don't meet those. They just go over and they don't respond to you. Then this is how you can monitor that. Um, and you can send statements to a patient. Like, let's say we'll check off a couple. You can download statements, or you can send statements again to their PHR account to email, whichever method you prefer. Or you can download them, mail them, and then mark as mailed. Although that is the longer and more expensive way to do it. Uh, okay. And then once patients come in, once you send them statements, and there will be an option here when you send a statement or an invoice to allow payment through PHR. If there's some other way that the patient pays indirectly, let's say they just go to the provider, they give them a check, and then the provider just tells you that the patient paid such and such, then you can go to this receipt section and you can add that payment information in here and indicate which invoices this payment is associated with. So let's say I wanted to search for a patient over here. You search for a patient and it pulls up all invoices that you can check a box to show invoices that are due and have patient responsibility. This particular test patient doesn't have any, but you can see all outstanding over here as well and put in payments accordingly. Okay. So that covers the fundamentals of BillerPro, how it works as a tool, and how the basic workflow is. So now we're going to go over some other features of this software that are more specific to BillerPro. So we are going to go to, just give me 1 second. Okay. So we're going to go to the admin settings. And this is when you create a BillerPro account and when you start adding practices, there are some things that you may want to set up so that your billers, your AR team, your posters, they don't have to worry about certain things. But also just basic member management. So under this RCM admin actions section, so again, I just went to the settings over here of you'll see that there are several options here, and we're going to go through some of these. So the RCM members, this is if you want to add a user to the Biller Pro account. You can see which members are active, which members have been invited. Generally, adding a member is super simple. You just add a member and then put in their name, email address, and you specify a role for them. So we also support role access, and and these are certain predefined roles, but you can customize the roles to whatever you want. You can also there are additional privileges that you can assign to members on top of roles, and this is also where you would add or assign which practices belong to which member. So that's where you define that. Uh, The second thing that I want to go over is mandatory chart details from practice. So this is more for the EHR customers, but this is a way that you can define, let's say you work with one practice and that practice is supposed to handle their own coding. And you work with another practice and you've agreed to do the coding for them. So this is a way that you can determine practice by practice, essentially what their rules are. So this is information that you can mandate the practice provide you when they send to RCM. And if they don't have this information, then they would get an error message and it would not be sent to the RCM team. It would remain in their queue and they would know that they need to work on it. So let's say that patient demographics are just missing entirely. If you have this option checked, it requires demographics be put in. So when the practice tries to submit a claim to RCM for a patient that doesn't have demos put in, they would get an error message and it would not be sent to RCM because you don't have the information that you need. And similarly, what I was talking about with coding, at the bottom here, we have patient treatment information. So you can say for one practice that they need to have CPT codes and diagnosis codes present. But then for another practice, you can say, we don't need this information. We are going to put in this info ourselves. And you can update this per practice. And you can also, there are some very useful things that you can mandate here, such as only allowing signed encounters, which is just generally solid. It's not good form to be sending encounters when the notes have not even been signed yet. That's something that you can mandate from practices rather than having to deal with it on the side. We're going to go to the configurations next. So configurations, this is generally miscellaneous options. There's a lot of niche things in here. I'm not going to go over these too much, um, but there are certain things that can be handy here. For example, you can allow practices to add attachments to invoices of you can enable payment reversal expected. So this is for your posters if they're posting a payment, but you know for whatever reason that you're expecting a reversal on it. Let's say an insurance is paying, but you know that the patient has a coordination of benefits issue and you're expecting that that payment will be reversed in the near future. This is something that you can enable to allow your posters to make a note of that when they are putting in that payment. And then we also have some payer-specific rules for telehealth of automatic ACE testing. Like I said, there's a lot of miscellaneous options in here. Of so we also have I'm going to go over two main other categories. The first is the claim generation settings here. So by default, when you transmit claims, if you have the service facility NPI and the billing provider NPI on a claim, so box 32A and box 33A, if they're the same number, by default, per the 837 file transmission rules, uh, box 32 would not transmit at all in that case. And that's fine for most insurances. That's the way that they want it. But sometimes an insurance does want it in that case anyway. So you can check these boxes off as yes over here in order to transmit that information. More importantly, you can do this at a payer by payer level. So you can add a payer rule and say, for Ambetter, for example, Ambetter is an insurance that I know requires taxonomy codes to be listed on their claims. You can create a payer-specific rule that says, for Ambetter, have this option selected as yes, and then everyone else would use the default options, which would be set to no. And so here we can see if I select a practice, I don't think Ambetter is listed here, but let's say hypothetically Aetna needed taxonomy numbers on claims. You could set up a rule here so that this would say yes, and then update it. And then whenever you generate a claim, it detects which insurance or which insurance the patient has. So when it detects that this insurance is on the claim, it's going to apply these rules. And lastly, I want to go over some of these category options. So this is a useful way for admins to track and create custom categories for certain things. So let's go to claim categories, for example. You can create custom categories for, let's say you want to track all of your workers' comp claims and you want to give them special attention so that you want to be able to see just your workers' comp claims all at once. Another good example is, let's say, a provider does a lot of regular work. So let's say they're OBGYN and they do E&M visits. Uh, they do basic diagnostic work. But let's say they also do deliveries, which are a procedure that is vastly more involved, and you want to be able to monitor just those deliveries and see very quickly if they're being denied, if they're being paid, if they're being underpaid, all of that. So you can essentially create a custom category for them assign them a description, a color, and when you are in the claims section, so for generated claims, you'll see that some of these already have this custom category associated with them. You can filter your claims by this category, and you can also assign a category over here. So if you click the dot 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 next to a claim, there's an option to set the claim category. And then let's say I want this to be workers' comp as well. I update it, and now this is listed as a workers' comp claim. So these category options are not just for claims, they can also go for specific payers. So if you wanted to sort all of your workers' comp or no-fault insurances into their own categories, you absolutely can. There are rejection categories for this is primarily if you're using another clearinghouse and you want to monitor rejections within BillerPro. You can create categories and descriptions for your common rejections here and assign them as appropriate. Similarly, with claim transaction status, you can create custom transaction statuses for the submission on your claims. And there's also user task categories. So this is going to lead in nicely into the next thing I want to talk about, the task system. So you can create certain categories of tasks that you want people to do. So let's say you want to tell your biller and you want to assign them a task. This claim was denied. I want you to appeal this claim. So what you could do is you could add a task category here, and you could call this appeal. Let me just do this right now. Okay. So this is going to go into the task system. I'm going to go back into the dashboard and we're going to go to tasks. And here by default, you'll view all the tasks that are assigned to you, the current user. But admins can also define who is able to create tasks and assign them to other people. So this would be useful if you have account managers, for example. You can add a task to a user, give it a due date, give it a category. So let's say I want them to appeal something, and then you can put in any information about that task over here. Just give them the instructions and then add it, and it would be assigned to them. You can also add a task through a claim. So let's say you're looking at your claim list and you know that this claim has been denied and you want your AR to appeal it. What you can do is you can click this dot dot dot, you can go to others, you can go to tasks, and you can create a task just for this claim. And this will also show you if there have been any other tasks created for this claim. You can see even closed ones as well. Um, but if you add a task here, it's gonna look exactly the same, but you're able to assign it to a user, give it a due date, and then this way, when they open the task, they'll be able to see which claim you're talking about and work it from there. Uh, so we also have an integrated EFAC system. I'm not going to show this off just because it's not set up on this account, but essentially, we have an integrated eFax that you can view the faxes that you've sent out, any incoming faxes. You can see which accounts those faxes are associated with. Um, and in general, there's no need to have a separate third-party eFax system. You can have it just built into your BillerPro account. So the last thing I want to go over is this rule engine over here. So this is another thing that can be used to help out your billers when creating claims. You can essentially define certain rules for certain billing rules. So let's say that we have CPTs that are bundled together. So you know two procedure codes are bundled as per NCCI coding edits, and you know that of when you have two CPTs together, one of them needs a specific modifier. So what you can do is you can create rules. So let's say these rules are already created. Our system can detect when a claim has both of these CPTs on the same claim, and if it doesn't have a modifier, but it can be unbundled with a modifier, it's going to give them a notice on the claim itself, on the little sidebar when they save it. That'll tell them that there is a bundling rule and to add a modifier to this second CPT over here. And this is not just for bundling, so this will be for add-on CPTs. You can designate certain ones as add-ons, and then it'll detect if a claim is generated and it only has an add-on CPT, but it doesn't have anything else. Then it'll give them a notice saying, hey, you need a primary CPT here. This is just an add-on code. You can't have it by itself. You can do this for mutually exclusive CPTs. You can come up with new versus established CPTs, unspecified CPTs, anything with an age or a gender limit. And the age or gender limit also goes for diagnosis codes as well. So, for example, this would be really useful for pediatrics, where there are all sorts of diagnosis codes that are based on a specific age range. So this system would automatically detect, and this would be even if the provider just doesn't monitor this so well, if they create an encounter for a patient and they just use the wrong age diagnosis on it, then this would allow our system to automatically catch that during billing and tell the biller that they need to change the diagnosis to the one that is appropriate for the patient age, just based on their date of birth and demographics versus the date of service on the claim. Okay. And we also have just additional rules and configurations that warn a biller if there are duplicate claims or duplicate CPTs on the same date for a patient. But you can have these set to no. There are certain cases where it is appropriate to have multiple CPTs, same date, different claim. Billing is funny like that. Uh, but this would give you the option to configure this rule based on your specific needs. Okay. So I do want to conclude this webinar by going over the EHR integration and how this looks from the EHR side of things, because this platform, if you have an EHR, like if you have a Charm EHR customer, um, then this is a two-way transaction. So let's say I checked eligibility for a patient and a biller checked, rather, if I was a biller and I was checking eligibility for a patient through here, and I ran an eligibility check and I saw that a patient was inactive, it would actually update the patient's eligibility in Charm as well. So the practice's front desk could also see that the patient is listed as inactive, and that can be a useful thing. So let me just switch over real quick to uh, window here. Okay. So I have in a separate window here, I am logged into an EHR account that is tied to the BillerPro account that I was just looking at. So like I just said, this patient list is connected with the BillerPro list. So if a BillerPro user adds a patient, it's also added here. Likewise, if you run eligibility for them, and you go to patient details, well, this patient doesn't have an insurance, but if they did have an insurance, then you could see their eligibility status over here. I also want to go into how the practice would send encounters over to RCM here, because it's a really simple matter. Um, when the practice sees a patient, they're going to add the patient demographics, insurance information, or maybe they send the patient a questionnaire and the patient fills in that info themselves. And then the provider sees the patient and they create an encounter, they chart the encounter appropriately. They'll add their CPT and diagnosis code if they're doing their own coding, and then they would sign their encounter. So you'll see that if I go to this billing section, the first place it goes is this generate bills. And I can also filter these by encounters that are signed and ready to go out. And so for the practice, it's a really simple matter of just checking a box to indicate I want these encounters to go out for billing to our RCM team. You just check this box, and then there's a submit to RCM option. And if there are encounters that they have that don't need to be sent to insurance, let's say it's a self-pay patient or someone created an encounter, but really all they were doing was updating a prescription, then you can also go to your encounters over here. And if you know that, let's say this encounter does not need to be sent to RCM, it's not meant for billing, then you can just check it off. And there is a billing not required option to oh, well, this was already sent to RCM. But this would move it into a separate bucket over here that says RCM not required or no billing required. And then if you change your mind, you can just check them off and say that billing is required for them or RCM is required for them. And then that just moves it back into this little bucket over here. Of Also, if the practice wants to manage their patient billing on their own, uh, they will have an invoices option here. And this is just like the EHR billing side where they can go to invoices and they can see all the invoices that are created for encounters. And they can add payments over here as well. They can add a receipt or they can go to an invoice and add a payment over here. And this, again, it will update on the RCM side as well. So if you add a payment, then the RCM team would be able to see that payment and they'd be able to know that the patient has paid for this portion of their invoice. So this would be most useful for things like copays, where for the most part, copays are essentially automated, where the practice collects them. And then when they create an encounter and then an invoice is created either by them or by the RCM team, that payment would apply and everyone would know that the patient paid their copay for that date. But the practice would also have the same functionality to send statements and invoices to patients, and it's looking very similar to what you saw in the BillerPro side. And the practice can essentially manage it that way without having to go to their billers for every little, copay or co-insurance or deductible payments. Okay. And while I have been showing off the EHR side here, I do want to let everyone know that we are open to integrating with other EHRs as well. So let's say you have a client that really likes another EHR software like eClinicalWorks. We are open into doing an integration with that other EHR so that users on their side would have similar functionality where they would be able to submit encounters generated in that software into BillerPro. And that's something to discuss with your sales rep, but I do want to let everyone know that that is an option and we can make some accommodations. Okay. And that concludes our demo of the BillerPro product. So if you have any questions, again, feel free to post your questions in the Q&A box. We'll happily take them right now. I'll start answering them soon. Otherwise, thank you all for coming, and we hope you have a wonderful rest of your day.